Hi, I'm Dr. Vonda Wright, and this is Hot for Your Health. So, Yoel, it's been a thrill for me to meet you and get to tour your labs and really see the scientists at work. I don't think people outside laboratories really understand the day-to-day business of creating health. But what I'm interested in is, why are you so passionate? Anybody who meets you knows that you are in love with women's health.
I think women are a critical part of our society. Saying that women are 50% of the population in the world is trivial. But the role of women far exceeds that number. Women play a key role in multiple levels in what we do in different communities. And I'll give you several examples. Women in working families play a key role in keeping the family together, in getting families to doctors, in ensuring the education for the children. And their health is therefore critical for those families, but it really goes beyond it. Older women at the age of grandmothers, they play a key role in helping their daughters and their sons to take care of their grandchildren. And grandmothers the health of grandmothers is absolutely essential for that function. Studies have shown something that was coined the grandmother's effect, which made an association between the health of grandmothers and the health of their grandchildren.
Really?
And the healthier the grandmothers are, the more they're able to support their sons and daughters in supporting the grandchildren. So healthier grandmothers, even beyond the age of reproduction, beyond the age of they make their own families, their health is critical for the health of the future generation.
That is fascinating, because when I talk about women's health, I talk about let's reach one woman, because then she's going to reach one family and ultimately one country. But what you've just said is, it's not just one woman and one family, it is one woman and all of the families that she has influenced. It's a multiplying, profound impact.
Our view of women's health is not just at certain one time point, or only the time of reproduction, or only the time of education of their children. Our view is very broad. Pregnancy by many people is perceived as a very narrow time point of 9 months that are affecting only women. And people do not understand the impact of pregnancy on lifelong health and wellness. And people also tend to forget that men are also born to women.
That's true.
And by understanding the role of women in carrying pregnancy in a healthy way all the way to term, it really impacts the health of society for many generations way after birth. So if you think about it, women play a fundamental role in the health of societies, communities globally, at reproductive age, at older age, during pregnancy, at many other time points in between. That's why I'm so passionate about it.
And I can clearly understand that, and I'm really getting excited talking to you about it. And there's one way that you have summarized so amazingly your belief that the health of women across the lifespan is important, but it's not just at birth. You have taken it back through to the minute we are conceived. That's when health begins, and you call it 990. Can you talk to us about that?
Yeah, the 990 is a term we coined to capture the role of 9 months of pregnancy on 90 plus years of health.
Yes.
People nowadays live more than 90 years, and maybe we should call it 9 to 120. But our view is very broad about the role of women during these 9 months of pregnancy on societal health. Healthy pregnancies actually start even prior to conception. And your group and this people attending this conference realize that the role of the health of women, even in a period that precedes pregnancy, is critical for healthier pregnancy and beyond. The 9 to 90 puts a great emphasis on 9 months of pregnancy and how they shape 90 years of health. Studies that were done in the last 30 plus years have shown that inadequate support during pregnancy, support meaning maternal support or environmental support, nutritional support, global health support. Inadequate support may be associated with diseases, and the impact of these diseases can affect the unborn child, has implications for health even 50, 60, and 70 years later. And as we said, this affects women and men equally. So our concept of 9 to 90 captures the idea that healthier 9 months of pregnancy may imply healthier 90, 100, 120 years of life for women and men.
I have to tell you, as a woman who's had a child, that puts an entirely new meaning to all those trivial things we think we give up during pregnancy, the oysters and the wine, because if it's everything about how we're gestating our child affects them into the future, it's such a motivation to capture health at every single minute of our lives.
And at times you think that perhaps if we find a relatively easier way to intervene during pregnancy, we can prevent illnesses for society many generations later. Think about the economical impact that may have as prevention of diseases such as diabetes, such as obesity, and there are consequences on heart health, on orthopedic health, on movement.
Right. I think it's endless, and it's the financial impact for society, being able to take care of people the way they deserve to be taken care of, but also how we live our 90 years. Because I always say, I want to be healthy, vital, active, and joyful, but it's my opinion, and it seems like it's yours, that it starts with our health.
It does, and I think for many years people did not realize those critical roles that women play in our society, and therefore studies were done in men and then inferred to women. Researchers used to think that women should not be subject to studies because they have hormones that alter during their lifespan. They have other influences that may skew the studies. Obviously, this is not only not true, but also even if it was true, it is still critical to study those periods of time in women's life and women's health. And we firmly believe that by contrasting health of the two genders, we can make important inferences and important understanding and insights into health and wellness, not just for women, but also for men.
The federal health insurance marketplace is now open. That means you're free to shop for the health plan that's right for you. UPMC Health Plan has some of the most affordable plans on the marketplace. And they all give you full in-network access to UPMC, plus other doctors and hospitals in your community. Visit upmchealthplan.com or call 1-855-297-UPMC to learn why so many people have chosen UPMC Health Plan. Enroll today.
You know, the realization this 9 to 90 concept has great depth to it. And you know, you and I are biologists and physicians, and we both know that how important it is to understand fundamental processes, how they can impact diagnosis, how they can impact therapy, how our goal is really not just diagnosis and therapy. Our goal is prevention.
Yeah, exactly.
And,
That's
and
exactly
so many
my goal.
simple things that we can do in during times of health, such as pregnancy. Pregnancy is not a time of disease.
It's
pregnancy
not a disease state, is
the
it?
pregnancy is a time of health, and and by I think getting better understanding to simple things that can be done during this period to enhance quality of life for the unborn fetus and quality of life for the mother. There's so many things so many aspects of our lives that can be influenced. And I think if we understand deeper the biology that you and I discussed, the cells, how they differentiate, the formation of the membranes, the support of blood supply to the fetus, I think those are very simple, healthy things that if we can be preserved in a healthy state, I think the implication for society is huge. So imagine 50 years from now, people think about it and they will say, what, you did not study pregnancy?
Yes, yeah. What was wrong? It's the beginning, right?
It's the very beginning, and it's not only the beginning, it's also the period of the greatest plasticity of our tissues. If you want to improve the life of cells or tissues, this is the period of great response. It is very difficult to take cells at the age of 60 or 70, bones, cartilages that you work with, and try to really shape them in a way that you think would enhance health. But to take tissue at a time of maximum plasticity, attenuate harms, enhance wellness.
Yes.
These principles really should underlie what we do.
The women that attend this conference, when we looked at their demographics, almost 80% of them have graduate degrees. So they're smart. And so to give them enough biology that it clicks in their heads, they're like, oh my God, I can understand and not treat them like they're not smart enough to understand the biology, because they will. I mean, they're all very we just draw that kind of crowd.
Right.
So yes,
this is good.
I'll have you on the dais and we'll talk about it.
I think drawing and using and working with this crowd to the educated women in our society, to if they're better educated, if they understand the principles that we know and we try to enhance our knowledge in, they not only spread in their families, they become our ambassadors.
Exactly.
And Vonda, I have to admit, the one thing that impressed me the most about what you do is not just the delivery of information. You're engaging women through understanding motion, through understanding wellness, through understanding health across the lifespan. You're engaging women in a way that you create many ambassadors. There will be millions of Vondas walking around and carrying your knowledge throughout the world. There are many people around the world, men and women, who are thirsty for this kind of information. And I think by creating this movement that you're creating here in Pittsburgh and beyond Pittsburgh, and I think carrying through blogging, through tweets, and also through videotaping and just putting it on your website, I think that carries a very, very important mission. It is not enough to do good biological science. We have to take that knowledge and to spread it to everybody. And there's nothing that is too complex for people to understand.
No, they're smart.
And we study the placenta, and people talk to me about what is this thing, this thing that gets thrown away after delivery.
Right.
But when we talk to people and we tell them that the placenta for the baby does what our lungs and liver and guts and kidneys and hormone system do for us as adults, it all of a sudden you see the placenta in different contexts. And if you understand that the health of the placenta is absolutely critical for the health of society, it shifts the whole focus of what we can do to different periods in women's lifespan in a much more meaningful way. So I think this is really the essence of the movement, is not just the focus on women, but it's the focus of the lifespan on events that start from the very, very beginning of life and goes all the way through, hopefully not just 90, but 120 and beyond years of health. And I told you the grandmother's effect is real. It's been published in journals, and it is shown that healthier grandmothers have healthier grandchildren. So think about.
I didn't know that, but that's fascinating.
So think about evolution. How many people think that the role of women in evolution ends at reproduction? Because what is evolution? Evolution is how you transmit your genes and other influences to the next generation. When you cannot transmit anymore, then your role ends.
Yes.
And women cannot transmit anymore when they go through menopause. However, the studies have shown that healthier grandmothers better support their grandchildren, which means that grandchildren, they carry their genes. So women have a critical role not to transmitting their own genes, but by supporting the genes through
their genes healthy.
And through their daughters and sons, they keep their genes healthier, even at 50 years, born 50 years after them.
Well, health-wise, that makes complete sense to me. But even socially, I'm Chinese, and in Chinese culture, it is so common that the grandmothers raise the children. And so in my own household, I'm a working mother, I'm gone a lot, but every single day, who is influencing my 7-year-old? She just turned 8 today. My 7-year-old is her grandmother. So it just rings a complete alarm to me that you're right. The healthier my mother is, the more vibrant my child is.
It does.
It's the truth.
And I think that realization should lead to our understanding of the role of parents throughout society. Frankly, the success of your women's movement should be to have 50% of the audience men.
Yes, exactly.
And it should also be to be able to demonstrate the grandfather's effect, where grandfathers will have an equal role in rearing and supporting their grandchildren and their own genes.
Yes, I love that. That's our next phase, Yoel.
Yeah,
Okay.
it was a Nature paper, I think it was 2004, that showed very nicely in 2 populations in Europe and also in Canada, showing this grandmother's effect. And I'll send you the reference.
Would you?
Yeah.
That would be great.
And you can cite it. It's a fascinating topic, and I think it does, because many of your audience are grandmothers, and many of them tend to think that involvement in what you do is important for their daughters, you know, who are reproductive age or women, and they think they're in a more kind of distant supportive role, but they actually have a critical role for maintaining and supporting families. And I
don't think they realize it, because now it's, you know, I don't want to get in the way of my daughter.
Right.
But the fact is they must.
Right.
Yeah.
Right. There's so many illnesses that affect older women that I think you deal with professionally, and issues such as bone weakness, osteoporosis and the consequences, joint disease, but also other issues that women come to you with, menopausal symptoms, and of course pelvic floor dysfunction.
Yes.
And these are what I tend to call the silent epidemics, affecting so many women, yet they're embarrassed to talk about it. And at our research institute, we do everything we can to enhance those issues by an open conversation. And one thing I'm impressed with what you do is the openness and the direct conversation. You've chosen several key issues to take them to a much higher level in openness, in communication, in delivery of information. I do believe that your success is going to be by men and women listening to you and becoming your ambassadors.
Absolutely. Thank you so much for talking with me today.
Thank you very much. And again, I want to thank you and everybody who participates in this unbelievably important movement that emanates here in Pittsburgh, but hopefully will become a beacon for the whole world.
Absolutely. Thank you.
Thank you.
Thank you so much for joining me this week for this episode of Hot for Your Health. You know, you are a powerful force in your own health, and I'm excited that you took the time this Thursday to learn more from our nation's authorities in health. I hope that you subscribe so that you don't miss one single episode. Join us next week for Hot for Your Health, and for more information, find it at womenshealthconversations.com.